This podcast is brought to you by Feel Good Omega H+. The H is for you, the human, and the plus is to emphasize our goal of helping you achieve healthier and longer life. Feel Good Omega is our first product in the new human line. Why human line? Because dogs need healthy, happy, and mobile people to go out on adventures with. And if you don't have a dog in your life, you deserve to enjoy a healthy body and sharp mind too. I've been taking omega-3s for many years now, but if you are currently not taking them, it may be worth knowing that they are essential and the body cannot make them. Because of the impact of civilization on our food, it would be hard to come across someone who does not need omega-3s as a supplement. Omega-3s are essential to cell repair of the whole body and the organs. They support good memory, brain, and nerve function. They reduce inflammation throughout the body without side effects. Omega-3s help cell repair, skin healing, and prevent organ disease. They will also make your skin radiant, healthy, and hair shiny. Feel Good Omega is essential to maintain heart health, which is obviously very important. In addition, as every product in our lineup, we've meticulously searched for the best ingredients to ensure that the product is top quality, free of toxins and heavy metals, and is also gentle on the planet. Feel Good Omega H+ is free of GMO, dimethyl sulfate, and we use no methyl alcohol in the extraction process. It is also packaged in glass, which is super important for you and also for the planet. Don't miss out on feeling good. Check out Feel Good Omega H+ at feelgoodomega-h.com. Again, the website is feelgoodomega-h.com. Hi everyone, I am so glad to have my very dear friend and colleague, Dr. Edward Bassingthwaite. And Edward is in Melbourne, Australia, and he's a holistic veterinarian of 24 years and also the founder of the Whole Energy Body Balance Method. And we will learn about what it is. But before we go there, Edward, I would like to first explain why we are sitting here. This is actually our third time we are recording together. The first time we had Facebook Live. The second time we attempted to record this podcast/video recording, but my sound didn't work. And so we're here for the third time, and I really appreciate your patience and also the fact that you're here again to learn about your work and learn about how you became a vet and all the interesting stuff. You know, where did you grow up and what did you do and how it affected your decisions, future in your life?
Okay, so I grew up on a cattle property in North Queensland here in Australia. So it was about 120 square miles of country, which is kind of huge by European standards, but it was about average size for that part of the country. We had cattle, we had horses. So we bred and trained and competed on horses a lot. And my early life I was really passionate about working with horses. The methods they used for training horses when I was young were not very kind. They weren't very up to date, shall we say. But I came across the work of a man called Monty Roberts from America, who has a book called The Man Who Listens to Horses. So he's one of the greatest natural horsemen that's ever been, I think. And I started really exploring how to connect with animals on their terms in ways that they understand so that there could be communication and connection rather than using force and pain and fear to make animals do things, which is something that I saw a lot of when I was a younger man. And I think that's where I first started to really branch out into alternative ways of working with animals.
Horses were one of your first point of contact. It's kind of interesting because I started with horses as well. I also saw that horses were not always treated the best way. I felt kind of helpless in the way of not being able to help them basically as a kid, as a teenager. So, I always enjoyed the parallels in my colleagues' lives. And that's why I asked the question, how early life affected you. So that brings me to the next question. Do you remember the moment when you decided to go to vet school, or was it a gradual process, or was it like, I got it, this is what I'm going to do?
So I read James Herriot's books when I was very young and was fascinated by the stories of life as a veterinarian. And another thing that affected me was that when I was very, very young child, we still had tuberculosis in cattle in Australia, and we would have vets come out to test the cattle for TB. And I remember being very small and watching these vets doing veterinary stuff and just being fascinated by it. And I think too, I've always worked with animals my whole life, probably pretty much since I can walk. One way or another, I've been working with animals. So I think then when I got to the end of my schooling, I decided to do a veterinary degree. And at that time, I thought I would go back to the family farm and thought that veterinary science would be a useful thing to have. Life's turned out a whole lot different than that in the end for a whole lot of reasons.
Interesting, interesting. Do you think there's a difference between the way James Harriet described veterinary medicine and the real life?
Yes and no. Certainly, my first job out of vet school was in mixed practice in Western Australia. So there was dairy, beef, some equine, small animals, and bits and pieces of everything. And I've got plenty of stories I could tell about working in that job that could come straight out of just about any James Herriot book you care to name. So I think there still is that, and at the same time, I think veterinary science has changed a hell of a lot since then too. We have much more technology that we can use to help us or hinder us, depending on your viewpoint. But certainly, our ability as veterinarians to do diagnostics with imaging and testing and things like that is streets ahead of what was in those days with James Herriot. But I think that the core thing of connecting with and caring for animals, and not just the animals, but the people who belong to the animals, is still very much the same as it was in those days.
Do you think that people have any misconceptions about veterinary medicine, pet lovers, animal owners, farmers?
I think one of the biggest misperceptions that I see is that people think that vets earn a big stack of money, and we don't. We're one of the most poorly paid professions in Australia. That's just
You're
a fact.
driving a Rolls Royce and living the life.
I'm not driving a Rolls Royce, and I think one thing that I hear a lot from people is that they don't trust vets, and that they think vets are just out there to try and make money out of their animal's illness, which I think is a really sad thing that many people think that, because it's not true, and if anyone who's ever known anyone or owned a veterinary hospital would know that the overheads and expenses in running a hospital are insane. And most vets really don't make much profit, even though the services are expensive, and they're expensive because you need a lot of expensive equipment and staff to be able to give good quality vet care.
I really appreciate you bringing this up, because I've seen the same thing. I think that people, especially in countries like Australia or Canada, have no conception of what healthcare costs, and in Europe as well. In the US, it's a little different, but that results in people constantly complain about the bills. And if they would see a surgery bill for their knee surgery and then a dog surgery, they would be shocked how cheap we are. I agree with you. I've seen many veterinary clinics, and most veterinarians do not make much money. The best case scenario, people probably take $20 out of 80. So everyone can kind of calculate how much the owner of the clinic actually takes home. And there's a lot of education, expensive education, a lot of hard work. And if I think of any real estate agent or some sort of dealer wheeler, like, they usually make much more money than veterinarians. And nobody worries about buying an expensive purse or expensive shoes. And then they come or renovating kitchen. I actually have had one client telling me that she couldn't afford a $2,000 bill because she's doing a $50,000 kitchen reno. And she wanted me to empathize with her, and I didn't. I actually felt really sorry for her dog, because if a kitchen cabinet is more important than her dog, then I think she shouldn't even have a dog. It's a serious problem.
It's a serious problem. And, the vast majority of vets I know really care for animals, are doing everything they can to help animals. And most vets don't overservice and overcharge. I mean, in some big corporate clinics, there is a lot of pressure to do that. And that's a different story, probably for a different day, talking about the corporatization of veterinary science. I mean, what happens then is you get a whole lot of, you've got to pay for a whole level of upper management that do get paid a lot of money, but the vets still don't get paid anymore.
So if there was one advice that we could give everyone, find out who the owner of the veterinary clinic is and support the independent or small group veterinarians who are not part of these big conglomerates. And I know that it happened in Vancouver, that they go around and they buy up every clinic. And because vets eventually want to retire, they sell their clinics to these entities. And it results in overselling, in overusing diagnostic methods that are expensive sometimes. And we kind of move away from the common sense medicine that actually makes a huge difference and makes a difference between life and death to this industrial, mechanical, template-driven system that actually I think is not very useful. I've been thinking this morning. I went for a little swim in this flooded mine that Pax and I go to, and as I'm swimming, I often think about things. And I was thinking how crazy it is that in veterinary medicine, we are being taught to look at something from very, very close. If it's the skin, we look at the skin. We don't look at the body. We don't look at the environment. If it's the joint, we look at the joint, and we don't really look at how it depends on the rest of the body. And so I think that what needs to happen, actually, we need to zoom out a little bit and kind of see the whole picture as opposed to looking at something really close. Like if I look at my hand this close, I don't even know whether it's a hand or my ass, right? Like it's the same, it's skin. and they're both hairy. So anyway, so it's interesting. So how do you recognize, what would you tell people, or what kind of advice would you give people to recognize a good veterinarian from a less optimal one? I'm just gonna give it the polite name, politically correct name, or a bad veterinarian. How about that?
The first thing I would do is encourage you. Now, this might not be possible to do locally, but find a holistic veterinarian. If you have to have one who's distant that you interact with via video conference or telephone, that doesn't really matter. You can still have your local hospital to deal with the in-person examinations and whatever's needed on that level. But I really encourage you to find a holistic veterinarian and add them to your wellness team for your animals, right? And I think it's good to have a team of professionals to help you with your animals. Then if you're going to find a good vet, first thing to do is drop into their website. Have a look at the language they use on the website. Are they a fear-free clinic? So are they really working to give animals the least stressful experience possible when they come into the clinic? Now, I've started working in a vet hospital over the last 8 weeks, 2 days a week for the first time in 5 years. And they're a fear-free clinic, and they offer really high-quality medicine. They've got a fantastic team of people working there. But even with the fear-free thing, I'm seeing, wow, these animals are stressed out to the max to come into this hospital environment because they come in, they have uncomfortable things happen to them that we can't explain why we have to do these uncomfortable things to the animals. So you want the best possible and the kindest, most compassionate team of people that you can. When you have a veterinary hospital, the boss is going to dictate the culture or the vibe in that place. So if you have the liberty, if you live in a place where you can shop around a little bit, then go and have a consultation and ask for the owner of the practice and ask them some questions. See how they respond. Do they listen to you? If they don't listen to you, you don't want to be there, right? Because any professional who doesn't listen to you is not going to be the best professional for your healthcare, whether it's for you or for your animals. I know that they did some research where they took 30 seconds of vocal content from specialist doctors and they made it so you couldn't understand the words, but you could understand the tone of voice. And people could make an 80% accurate prediction whether or not that doctor would be sued by their patients from the tone of voice alone. Mm-hmm. So if you go to a vet and they talk down to you and they don't listen to you and don't connect with you as a human being, you don't want that. And if you have a place where you don't have the liberty of choice of veterinary clinics, well, go to your local vet clinic and see if you can find the best vet in that clinic, because there will normally be at least one vet who is significantly more compassionate and a better vet than the others. And then go to them. Yeah?
Is it the 80-20 rule?
I suppose it is, yeah.
I really like your suggestion to look for a team. I also love your idea about how to figure out what clinic to go to. I've been around many veterinarians, and I know exactly what you're talking about. I also think that one can watch whether people talk about themselves and what they know, or whether they focus on the patient and the client.
Yeah.
Ultimately, we are service providers, and yesterday I got such a great service at a little hotel in the mountains here in the Czech Republic, where the parking didn't really work well, and every time I tried to park, there was someone in my parking spot, and they were so kind, and at the end they said, we're not going to charge you for the parking because there were some problems. And it was just so nice to see that they actually understood what challenges it brought, and that they were compassionate, and it's really lovely to actually see. It's so nice to see when people actually empathize and understand your situation, as opposed to talking about themselves and what they know and what they don't know.
Yeah.
And they, as you said, talk down to you. I really strongly believe that one of the courses in vet school should be effective communication. And,
Yeah.
they quite often focus on marketing and how to market practice and all that stuff. But I think that if you're a good veterinarian, you need no marketers, because you'll just basically have practice bursting in seam. And I also suggest that maybe online reviews are actually a good way to kind of read through and see what the concerns
Yes.
are, and also at the replies, because if you see how people reply, how the staff replies, it's important. If you pick up a phone and call the veterinary clinic and see how the front desk staff treats you, whether they put you on hold forever, and whether they are nice and polite or not so much, all that actually kind of reflects, as you said, the company culture, the clinic culture is set by someone, but at the end you can recognize it on so many different levels. So I like your suggestions. So let's go back to dogs and health,
Yeah.
and maybe other pets. I know that you're treating, you look after, you work with cats and dogs. Any other animals that you work with?
I did see a bunny last week, but it's very rare for me to see rabbits.
Yeah, people think that bunnies are actually easy pets, and I find them very difficult to treat,
No,
very
they're
difficult to keep
not.
healthy, right?
Yeah, they're
Super
sensitive
sensitive.
little creatures.
Yeah. So let's go in general. What do you think are the three pillars of health?
I think number one is going to be diet. Number two is going to be the human, because the human has the biggest positive and negative effect on the animal of any other factor. So I often encourage the humans to start caring for themselves. And one of the things I do is I ask this question. I say, do you treat yourself as well as you treat your dog? And they'll go, no, of course not. Right? And I say, well, why not? Have a think about that, right? And what I do an exercise with a lot of my clients, where I say, if your physical body, this human vessel that you inhabit, was a dog, what breed would it be and what name would it have? And they usually go, this is kind of weird, but if you do that, if you honestly do that, like my body is Bobo the Black Labrador, right? And a therapist of mine got me to do this, and it led to me having the most profound shift in my relationship to myself, in terms of I started treating myself much more kindly and caring for myself better just from doing that. And there's a whole lot of other stuff that humans can do to help care for their animals better in terms of looking after themselves. And the third pillar, I think, is what I teach, which is teaching humans how to communicate better with their animals, so that they can communicate with their animals in a way that the animals understand, so that you're speaking the animal's language. But not only communicating with the animals, but empowering the humans how to be able to feel into their animals' bodies and find where there's silent pain and tension, and then be able to do something about it with bodywork skills. And anyone can learn how to do this, right? it took me probably 18 or 20 years to work out how to do it. But once you've learned how to do something, it's often much easier to teach it to new people. And I often have people within a couple of weeks of starting to learn this work. Wow, they're saying, well, my dog's just a different dog. They're so much happier. They're so much better. So, for instance, I had one student who had a daughter whose dog was a rescue dog, been severely traumatized and abused, had multiple behavior issues going on, had tried every prescription behavior medication available, and none of them had worked, right? Severe anxiety and a host of other health conditions that were being made worse by the anxiety. And within 2 weeks of starting to learn how to do the body work, she said, wow, this dog's nearly back to normal. Anyone can learn how to take their animal's health into their own hands in a really profound way. And I think that would be my third pillar is, yes, you need vets for their expertise, but there's so much you can learn to do yourself. And this is not just with the body work I'm talking about and communication and boundaries, but you can go and learn about how to feed your dog properly or your cat properly, and you can go and learn about what supplements are going to give your animal peak health and delay or prevent aging related issues and other things like that. And you can learn how to train your pets. You can learn what sort of activities are going to be good for them, support their well-being in a whole lot of ways. So that would be the three pillars for me, I think.
They're very similar for me because when it comes to nutrition and providing the body what it needs, it comes without saying for sure. And food is the greatest medicine. I often laugh when I see dogs and their people because beside them having the same hair color and the same body shape often, I do think that there is some sort of energetic resonance. It's not any different than when you see married couple after 30 years starting to look similar, even though they came from totally different genetic pool. And when it comes to communicating and communication with the body, with the animal about what discomfort they go through and the physicality of the body and how important that is to address, I agree with you 100% too. So it's nice to know that we are aligned. And even though we work slightly differently, and that's what I like too, we kind of converge. And this is where the idea of a team and working in a team and communicate and actually passing the knowledge on to the dog lovers is super important. Yesterday, we were hiking up the tallest mountain in the Czech Republic, which is actually not that tall. It's only about 5,000 feet. But I happened to talk to two dog people. One of them was a guardian of a 1-year-old border collie. And, it was so interesting to see a 1-year-old border collie, lovely, lovely dog. But I immediately recognized that the dog was fit kibble because of the hair quality and the kind of the body setup. And so I usually just kind of talk a little bit about how much they love their dog and so on. And then I give them, let's say, the recipe maker web address. And this lady was actually so sweet because I don't tell them that I'm a vet. I just give them the recipe maker web address. And then she posted a post or sent me a message on Facebook saying, hey, thank you so much. This was so nice. And I didn't know you were a vet. And so, I know that I made a little bit of a difference. And then there was another dog, father and a son had this German Shepherd on a choke chain, and they were going down the hill, and the German Shepherd is pulling like crazy and choking. And I started talking to them again. And, you can't just stop and say, hey, your dog is choking. You have to just kind of say, hey, nice dog. And then I said, you must love him very much. And, yeah, we really love him. And, I can see he's pulling a lot. I said, yeah, he pulls. And the trainer told me that I should put the choke chain in because when he's choking, he's going to stop pulling. And so we had a conversation about this. And I explained to them that there's a thyroid gland and the blood vessels and the vagal nerve and all that is basically controlling the whole body. And by the time, if we approach it kind of in a gentle way, we make a difference, one dog at a time. But I can't really walk by a dog like that, just saying nothing, because I feel like here I have an opportunity to change someone's life or helpless being's life by maybe it's going to land, the seed is going to land, maybe it's not going to, but at least I tried, right? And so it's just so much fun.
That pulling on the lead thing is a lack of communication. between the human and the animal, right? Because it's not hard to teach 99% of dogs to stop pulling on the lead pretty damn quickly if you know what you're doing. But you've got to know what you're doing, and you've got to listen to the dog and communicate with the dog through the medium of the lead. And if anyone's listening out there, the only time any pressure should be on your dog's lead is when you're asking them to do something. Should never apply pressure to the lead unless you're actively communicating that you want the dog to do something, as in come this way, walk beside me, stop and sit, or whatever. And most people just let the dog lean on the lead the whole time. They never realize that that's just, there's another way, I think. I think they think that's just normal. And I think the other thing that I really noticed with people and their dogs is 9 times out of 10, that dog is more determined than the human. And the human needs to be more determined than the dog when it comes to being a benevolent leader in that family unit that the dog's part of.
I think that we have our dysfunctions definitely show with our dogs, right? Like we
Oh,
don't,
yeah.
and to say everyone else who's listening and watching, if you feel like we're talking about you, we don't. We are actually trying to help and make a difference and bring awareness to it. We all have our dysfunctions. I personally have trained Pax to walk on the leash, but he is super hard-driven dog. So if he would walk beside me, but his tempo is actually a little faster because he's a 2-year-old dog and he's happy. And so it takes a lot of gentle kind of guidance and patience. And I know that some animals are really strong-headed, right? Like they have their idea of what they should be doing. If they have their instincts, if there is a bunny or if there's some sort of scent, like we have to tolerate this. But as you said, and I agree with you 100%, we need to be more determined about and kind of strict, lovingly strict to make sure that the dogs understand boundaries. That, for example, they know that when they're walking with us, they're not gonna be dragging us around. And I use treats because I don't know any other better method than food. But some people are even skiller or better in that. I do think that quite often we have lack of boundaries with our dogs, and they suffer because of it. Because you see a dog, let's say, on the lead, and they pull because we haven't been clear enough, or they bag at the table and suffer from not getting food because we've given them a few times and they don't understand that the table is not to get fed from. It's all really difficult. But we are humanly flawed, and it's nice to allow ourselves to be flawed but be aware of it, right? And then try to learn how to go about it.
Absolutely. And a lot of these things to help your animals have a better life are not actually difficult things to do, but they're emotionally difficult, especially in the beginning. So if you've got a dog that you've never had clear, healthy boundaries with, and 95% of the clients who come through my door are in that place, right? Humans are generally pretty crap at expressing healthy boundaries with dogs because they treat dogs like a human infant. And with a human infant, it's appropriate not to have any physical boundaries, right? But a dog is a dog. They're not a human infant. And when I first do this thing of saying, excuse me, I've got a personal space, every dog that comes in, unless they're a timid, frightened dog, I wouldn't do that with a dog that's like sitting in the corner worried. But if I get a dog that comes barreling in and want to jump all over me, I go, no, I have a personal space. I know this might be hard for you to deal with because you've never had a human actually say no to you coming into their personal space. A lot of these dogs, what the hell? What's this human doing? But very quickly, when you teach the dogs an out or come into my space, so you can just start to have a conversation about inviting the dog into your space or asking them to respect your personal space, that has so many benefits for that dog. If you've got anxious dogs, they'll often relax significantly as soon as they realize there's a boundary there and they know where the edge is with their human. And it's a really integral part of how I work with dogs with behavior problems is teaching the humans how to, in a kind but firm way, to start having a conversation with their dogs about the fact that they have personal space, because many dogs will tell their humans when they don't want the humans in their personal space, but the humans never do it the other way around, right?
Yeah, you made me think of many things. Like as I'm listening to you, I get really inspired, but also my brain keeps going because I'm thinking, okay, boundaries. I think it's super important to enforce the physical boundaries. I agree with you that we are not very good at it because I think that we kind of know what it feels like when someone denies us the pleasures of doing what we want to do. At the same
Yeah,
time, we're talking about physical boundaries not being as important in kids, but the emotional and mental boundaries in kids are super important because they actually keep them safer. I
yeah,
seen, parents asking a 3-year-old, "What do you want for dinner?" Right? That kid doesn't really know what he wants for dinner. Just serve it something that is actually healthy and don't spoil
Oh,
it by giving them pizza when they actually should be eating
yeah,
vegetables and healthy food because it's we are putting too much pressure on these kids. And at the same time, we don't actually let them go through some sort of emotional breakdown and throwing themselves on the floor in the store. Well, that's emotion. That's what we all would be doing if we could, actually.
yeah.
So we actually suppress the emotions in kids, and at the same time we don't set healthy boundaries with children and dogs, and then we actually make them suffer at the end, right? So
Yes, and there's a lot of cultural stuff in play here, and a lot of intergenerational trauma and behaviour patterns that have come down from our families of origin and all that sort of thing too. That this is where we get back to that second pillar of the human starting to deal with their stuff to help their animals, right? So we all have a whole lot of trauma and unhealthy cultural conditioning that if we really want to help our animals, we need to be brave enough to face, and that's uncomfortable, right? And it's uncomfortable setting healthy boundaries with your dog, and it's uncomfortable when you've got a fat dog and you say, no, you can't have dinner because you need to lose weight, because that's going to lead to some emotional distress for the animal, and you're going to have your emotional distress in the face of your animal's emotional distress, and that's got to be okay if you really want to do the best thing by your animal.
you touched another really interesting point about body weight, and to be honest, and I'm quite certain that you have experienced the same. I think that most animals have not they don't get overweight when they eat the right food because kibble is actually about 10 times as
Yep,
more calorie dense than
yep,
regular
yep.
cooked or raw food, meaning that these animals are able to eat 10 times as many calories as the dogs that are on cooked or raw food. So then it's easy for them to go overweight, and then we have to torture them because they actually never feel satisfied.
Well, I just want to say that I know a few dogs that are on raw and they're still fat and they still have to diet. So there's a spectrum there, but I totally agree with you that every dog that's overweight, most of them are on some degree of kibble, and when you take them off the kibble, they're going to lose weight a lot more readily, for sure.
I'm gonna be devil's advocate here, and I will say that those animals who are overweight on raw food, I would actually like to spend a week in the owner's house and see what the dogs are getting, how much.
I think there's some truth in that too, but I've had a few that I know are not giving them anything else, and I think some of these desexed female dogs, man, they just put weight on at the drop of a hat, and it's really hard to get it off them.
Yeah, I agree, and I agree that you cannot make a blanket statement about anything in life. So,
Yeah.
speaking of life, have you had any aha moments in life?
Wow, how long have you got to talk today, Peter?
How long do you want to talk for?
So, so I've had a lot of aha moments, ranging from small ones to large ones. So a little bit more of my backstory. So when I graduated, when I was first in veterinary practice, I came from a very conservative upbringing in North Queensland, and I totally believed everything they taught me at vet school. Right, so I just was indoctrinated into that Western medical paradigm, reductionist, focus on symptoms, treat symptoms with drugs rather than taking a holistic look at the whole animal, which you mentioned a little bit early on in this talk, how we need to zoom out a little and look at the whole animal as a whole being. And that's what I like to do in terms of how I work as a veterinarian. It's good to be able to focus in on the specifics, but if you lose sight of the whole animal and the context in which that whole animal is living, then I think you've lost your way as a doctor. That's my opinion on that one. My first job was terrible. My boss was an awful person to work for. So I only lasted about 18 months there. Then I did some temporary work in Western Australia. And when I was doing temporary work was when I met another really beautiful, innovative veterinarian, Dr. Tom Ahern, who triggered me into the whole hands-on thing. So he came up to work on some horses' necks. Now, he would take horses that had a forelimb lameness, that had been nerve blocked and x-rayed multiple times. They could not find any physical reason for it. And he had a particular method where he'd anaesthetize the horses and then stretch and mobilize the vertebrae in the neck, and the lameness would go away. So the lameness was coming from nerve root compression in the neck. And he was a lovely man, generous with his knowledge, had a couple of hours spare. So he sat down with me and just gave me a whole lot of teaching. And my first thought was, well, what about dogs and cats? Because I know they have necks and backs, right? So that's where I started. And there wasn't any focus on this at vet school. You know, the physical examination I got taught at vet school, in my opinion, is completely inadequate for finding silent soft tissue pain. Completely, almost completely. But what I started doing was really feeling into the animals' bodies with more intention and curiosity. And I started finding all sorts of pain and dysfunction, restriction from healthy movement in the bodies of these animals. And when I started doing this, there were no trainings. Like there's so many different trainings people can go and do in terms of working hands-on with animals and finding pain, massage, Bowen, Emmett, myotherapy. Well, you know, there's dozens of different trainings out there these days, but in those days there was nothing. So I just, possibly coming from a country background and just being taught from an early age to find out a way to do things that need to be done, I just thought, well, I'm going to get my hands on every animal and see what I can find, and then see how I can find a way to help them. So that was the start of me working hands-on with animals, and I've been doing that with passionate devotion ever since. Then I went to the UK. I was there for about a year and a half, and I became really seriously unwell with chronic fatigue syndrome and what I believe was Lyme disease, because since I've been on Lyme herbs, I've had radical improvements in my well-being. Now, this was a very drawn-out, painful aha moment, right? I was seriously unwell, like couldn't work at all for 2 or 3 years. Had a whole range of different symptoms. Western medicine helped me with some of them, but they very quickly ran out of answers. And if you've got a syndrome, that means the doctors don't know what's going on, right? That's medical speak for we don't know why you're sick, and we probably don't know how to help you much either. So I started exploring a whole lot of alternative stuff, and I'd get little incremental improvements. That's when I also came across energy healing and found that it helped me symptomatically, and that I could actually, when I went and did a training, I could feel this energy moving through my body and out my hands, which was pretty trippy for a conservative country boy, but there's something there, right? And the other thing I noticed when I was practicing this energy healing work at home was within 3 minutes of me sitting down and connecting with and moving energy, my little white Staffy would come running up the steps and sit at my feet. The first 4 or 5 times I thought, that's strange. But after 20 or 30 times, it's like, this is no coincidence. She can sense and feel what I'm doing, and she likes it. So she's coming to spend time in that space with me, right? So that was a big aha. Then I had, probably 10 or 15 years where I continually struggled with my health. I was never really well. I would go to an integrative doctor and they'd try some things, and I'd get a bit of an increase, and I'd plateau for 6 months, and then everything would stop working. I could crash again. Then I'd do another one. I did this for years, going to different practitioners until I got onto the Lyme herbs, and I got into Qigong and healthy diet for me, right? So I got into a lot of fresh raw food and raw juices, and that made a massive difference as well. And I also got a bad root canal, which was put in my head 18 months before I crashed, and that's when my health really started to slide, was after that root canal. Mm-hmm. And that was in there for 15 years before I had it taken out. So there was a whole lot of different factors, right, that played a role in it. But I think one of the biggest ahas for me was that And this came more after the end of my second marriage about 4 years ago, which I was left in a really shattered state, post-traumatic stress, because there was some narcissistic behavior patterns and it was quite an abusive situation for me to be in. It left me with complex post-traumatic stress disorder for some time after that. I think the biggest aha moment and what has been one of the most profound influences on my life is the awareness that the more I can bring my awareness into my body and be present in my body with whatever's going on, whether it be comfortable or uncomfortable, physically, mentally, or emotionally, the greater of service I can be to myself and to all the beings and circumstances that I meet in my life. And, this has become the core practice of what I teach in whole energy body balance work, is that the first thing that I teach to all my students, my groups of students when I meet them, is that we go through this somatic embodiment and energy connection practice. And if I'll just paint you a little picture, so if I'm teaching live, I might have a room with me and anything up to 10 people or 15 dogs in the room. And at the beginning of the day, all these dogs come in and they're in a strange place and there's this other dog they've never met before and all these people. And, the dogs are like wired. They're like, this is not comfortable. I'm not sure about this. And as I lead the humans through this internal process of bringing awareness into the body and just simply being present with whatever's alive in the body without wanting to change it or understand it or anything, really, just being a witness to yourself, we see all the animals in the room go like this. We're not touching them. We're not communicating with them. It's purely because of the state change in the human that you see this. And I see this often when I'm working in doing treatments with animals, whether it be in the hospital or here at my home. In the middle of the session, I'll just reinforce that practice in my own body, and the animals will take a deep breath, or they'll soften, or they'll yawn, and the humans will often yawn too at the same moment. So that I think is possibly my biggest aha, and this is my primary practice in my life in terms of how I live life, is to continually try to be more and more present in my body, because when I do that, I can serve myself and everyone around me so much better.
That's beautiful. I am listening with keen interest because I've been a big believer of the fact that our animals actually express how we feel, and that they're very much in resonance. They're like the tuning forks of our life. If we vibrate on a certain frequency of mood or energy, they will too. And I definitely see that. And I've been observing, because I visit with my family in Europe, and then I go to Canada, and I see dogs acting differently, behaving differently. It's kind of fascinating that even the national mood, or the kind of the way we approach emotions. I find that the more emotionally closed we are, the more dogs express for us for what we don't express. And interestingly enough, I see actually more dog aggression in Canada, where everyone, all Canadians are basically nice, and dogs are more aggressive. So that makes you wonder what actually is.
I think
I'm gonna. It at least that's what I'm seeing, that dogs definitely.
I hear you, and I think there's probably a lot of reasons for that. But I think in Europe too, dogs get to go everywhere from an early age, whereas in Australia and Canada, there's a lot more restrictions on where and how dogs are managed. They're on lead a lot more, so I think that plays some role in that too. But absolutely, the body language of the culture is going to affect how the dogs behave, because dogs are the most exquisite non-verbal communicators. They can read their humans, and but not only are they non-verbal communicators, they're extraordinarily empathic beings. And for me, my definition of empathy is experiencing the experience of another being within the sensory awareness of your own body. And when we get to Rupert Sheldrake's work of looking at how dogs know when their owners are coming home, I believe this is the mechanism. The dog feels in their body the feeling of the human deciding to leave work to go home, and they go to the door. That's what I believe is a mechanism. Now, I think that's unprovable scientifically, but that's my theory.
It could be possible that we could probably make some sort of experiment for people to imagine or think of something and see how their dogs react. But
Yeah.
what I'd like to do now is to ask you what makes your veterinary practice different from what do you know about how other practitioners work?
Well, I think probably the primary difference is that I'm much more sensitive to the dog's communication than most vets, and that partly comes from having worked with animals for, what am I? I'm nearly about to turn 50, and I've probably been working with animals for more than 40 years, one way or another. And, with working with horses and the natural horsemanship, you have to become very sensitive to very subtle communication from the horses to make that kind of thing work. And also, after I came back from the UK and was unwell, I did a weekend workshop with a fellow whose name I can't remember, but he was an amazing livestock handler. So, for instance, in the Arctic Circle where they have caribou and reindeer, you know how they tell what a caribou is?
No.
It runs away when you walk up to the herd, right? And the other ones are reindeer. They're the tame ones, but they live wild out on the plains. But this guy, he went up there to work with them, and he would start working the herd from 3 kilometers away. He'd be on a snowmobile or a four-wheel motorbike, and he would start interacting, communicating with the herd from 2 or 3 kilometers away. Guess what? He never found a single caribou, right? Because his ability to communicate through his movement with the movement of the herd and the response of the herd was so exquisitely sensitive that by the time he got up to the herd, all those caribou had been turned into reindeer. So I did a weekend workshop with him and played around with that a lot too, which also gave me a lot of insight into being very subtle about appreciating very small changes in how animals move, their expressions, their body postures, and things like that. So when a dog comes in to see me or a cat comes in to see me, I'm communicating with it as soon as it comes through the door. I'm doing soft, sleepy eyes, slow blinks. I'll yawn. I'm very, very careful about the direction and intensity of my gaze because that speaks so much volumes to animals. It's not funny. If I've got a dog that's nervous, I might just expose my throat a little bit to it. You'll often see the dog relax when you do that because what I'm doing when I do that is saying, I'm not a threat. It's cool. We can be friends, right? So I think that's a point of difference. And the other really big point of difference is the hands-on work that I do and the communication training work that I do with people, because with the whole energy body balance method, it is not only a really amazing thing for helping animals with silent pain, finding silent pain and relieving silent pain, but it also has a profound effect on the animal's nervous system. It causes a body level relaxation response, the quality of touch in all of the skills and very strongly in several of them in particular. So why I believe that there's such a huge anxiety problem in animals is that, particularly in dogs, is that one, there's a myth that an excited, crazy dog that you're throwing the ball for is a happy dog. And humans do a lot of this high arousal, high impact. Humans love razzing dogs up, right? We're monkeys. We behave like monkeys, and monkeys love to stir the pot up. I mean, throw coconuts.
Monkeys like to have drama, right? And action.
Yeah. So just about everyone, you get a puppy and they get the puppy and they scruffle its face and they make it crazy. They wind it up. They get it aroused and excited. We don't train our dogs how to relax. And I think it's a profoundly important thing and they often need to be trained how to regulate from arousal to relaxation. So my opinion is that all the anxiety and trauma problems that we see in dogs come down to one root cause, and that is an inability for that dog to regulate from arousal back to healthy relaxation. And I can teach dogs how to do that with body work, and I can teach humans how to do that in about 15 minutes. It's a really simple thing that I stumbled across after thinking about Temple Grandin writing about when she's an autistic woman who's become a world-leading expert in livestock facility designs. But when she was a teenager, she had a lot of anxiety and extreme difficulty with socialization with people. But she got along really well with animals. And one holiday, she went to a cattle ranch where they had a squeeze crush. the crush would squeeze in on the cattle beast and the cattle beast would relax. So she went home and she built herself one with 2 padded boards that would squeeze pressure into her body, and she found that it helped her relax and helped her a lot with her anxiety and arousal in the face of having to interact socially. So, I thought, well, how can I then apply deep pressure into the animal's body in a way that's going to cause relaxation? And that's one of the bodywork skills that I use. And I've been using that in the hospital a lot, So when I'm on surgery, and it's been an interesting challenge going back to surgery, I felt like a new graduate again. It's been so long since I've done much of that stuff. But you get the animals come in and I'm doing the body work, and you just see over 5 minutes, you see these animals go from, oh my God, I'm in the vet hospital, I'm going to die, to settling and relaxing, and often staying relaxed in the cage all day, much happier. And the staff at the hospital are noticing the difference in the animals that I work with as well.
That's nice.
Recently we've been in lockdown here again, so only the animals are allowed in. And one of the nurses said, how do you get all the calm animals? Because if you can communicate with the animals in a way that they understand, and then use body work to cause that relaxation response, usually within a few minutes, the animal's sitting beside me and calm and happy and going, okay, I'm at the vet clinic. It's not so bad.
Mm-hmm. Where do people find you if they wanted to learn more about what you do, if they wanted to take some of your courses?
I have two websites, wholeenergybodybalance.com and thehealingvet.com. You can also look up The Healing Vet on Facebook. You can message me there. I have a couple of regular free webinars. I have one masterclass on understanding, finding and treating silent pain in your pets, which I've done 58 times now, I think. And I do a free introductory workshop with the Whole Energy Body Balance, a 45-minute online free introductory every 2 weeks as well, which you learn the process I talked about, the somatic embodiment energy connection practice for you, the human, and then we go through relaxation body work and a simple energy healing skill in that time.
Great. Thank you. Everyone, if you wanted to get in touch with Dr. Edward, you can see that he's got a lot to share. It's been real fun and pleasure to actually for the second time. I almost feel like I'm glad that the sound failed last time, because I learned so much more, and we kind of know each other now, so it's easy to talk together. I have one more question. If there's one message that you could send into the world for people to remember, what would it be?
Awareness is the key to freedom. Now, this can be applied in every facet of life in terms of you caring for your animals. The more awareness you bring into your animals, in terms of you becoming more aware of how to find and relieve pain or discomfort, whether it's physical, mental, or emotional, the more awareness you can bring to yourself in terms of how you're living your life, your stress levels, how you manage that. As soon as you can't change anything if you don't have awareness of what's going on. So I would say that no matter what you're doing, whether you're talking about your animals in particular or changing your life so that you can be a better influence and impact on your animals, if you're talking about a particular health condition that your animal has, or you want to learn more about whether you should de-sex or not, go and learn and study. The more awareness you can bring into yourself, into your body and into your life, the more freedom you can create.
That's great. I like that you encourage people to curiosity, because I think curiosity is one of the ways of making things better. If we just kind of settle for the status quo, we never learn and we never change anything. And from curiosity, there is the passion that rises, right? When we are curious about something, when we realize that we're discovering something new, then we become really passionate about helping and changing. And that's how it comes to purpose, and that's how it, that's how we prevent depression. That's how we feel better. And I know that it has not been easy for any of us. I think that life is just basically a difficult journey, and the more tools we have to feel better, and as you said, look after ourselves, the more we can make a difference in the lives of animals and other people and make a difference in the world. So thanks so much for being here. Very inspiring.
You're welcome. Thanks so much for having me.
And we'll get together soon again, I'm sure.
Yeah, absolutely.
Bye everyone. Thank you so much. Take care. Bye-bye.